If you would introduce yourself for the record, and you're recognized to carry on, Mr. Law.
Thank you, Mr. Chair. Good morning. I'm Paul Rowden with Edwards Food Giant. On behalf of our 760 employees in 13 locations across the state, it's a privilege to speak to you this morning regarding House Bill 1035. Representative Bentley, I would like to commend you on the idea and the effort put forward to make the SNAP program more efficient in the state of Arkansas. While I agree with you in theory, I want to share with you a few concerns we have as a family-owned Arkansas-based business. First, let me say I'm a big fan of streamlining government programs for removing unnecessary red tape and for the cost savings that generally come with these efforts. On paper, this seems like a good idea, but I feel the theory is much different than the reality. This bill that's presented before you today addresses the idea that this could possibly create change, but doesn't address implementation or management at the retail level. It doesn't address the new state agency that could be a requirement to manage and consistently determine which items are healthy and which items are not. And it doesn't address the number of new state employees that would be needed to continually do analysis on constant changing pack sizes, ingredients, and package types. If this legislation were to pass, where would this additional funding come from to implement and enforce this at the state level? In terms of real-world implementation at the retail level, all of the burden from this legislation seems to be put on retailers. And the burden could be unbearable for small businesses like ours, not to mention those retailers across the state that don't even have scanning capabilities. The consumer food industry currently includes almost 300,000 unique, individually labeled items or SKUs. The average grocery store in Arkansas carries approximately 45,000 different items and is tasked with reviewing up to 15,000 new items per year. The proposal to restrict SNAP choice would lead to a government-created food list that indicates good food or bad food. These 300,000 food and beverage products and the additional 15,000 introduced every year would need to be analyzed and a database maintained by someone. Costs to administer these ongoing changes will especially be burdensome to grocers. And I agree with Representative Bentley's comments that there is a fraud problem, but I think rather than limiting foods and adding complexity to an already complex program, efforts should be focused on improving efficiencies, these fraud reduction efforts, and nutrition education. One person mentioned earlier the current restrictions such as alcohol and tobacco, which are done by departments. And we're talking about getting into line items and having a SKU of 5 items and 4 of them being acceptable and 1 of them not. And I just think that becomes very, very burdensome on businesses in Arkansas. Another issue to be considered is increased transaction time for all Arkansans. If this bill becomes reality, imagine waiting in the checkout line behind a single dad with his 2 children while he is being told by the cashier that the box of olive oil Triscuits he picked up are not SNAP eligible because they contain more calories than the hint of salt flavored Triscuits. Sir, you will have to go back to aisle 21 and swap these out. Who's going to determine the characteristics of healthy? Is it calorie-based? Is it sodium-based? Is it based on fat grams? Is it gluten-free? Depending on these many characteristics which have yet to be determined, you could have calorie scenarios where diet soda was deemed healthy and acceptable, yet orange juice was not, and therefore not an eligible SNAP item. Or a fruit punch flavored juice cocktail deemed healthier than apple juice. What about artificial sweeteners? Would these be banned, or would we be in essence naming these the new health standard? Representative Ferguson, you mentioned the WIC program, and I want to mention that briefly. The biggest difference for us as retailers and business in the state of Arkansas is that's a prescription-based program, meaning those participants meet with a Department of Health employee monthly or quarterly to discuss their food parameters and what they need for their healthy diet. And in this bill, there's no mention of that, and there's also no funding allocated to hire that state staff to meet with these individuals on an ongoing basis to determine what's healthy and what's not. This bill would cost businesses across the state a tremendous amount of money and would almost certainly lead to a large number of new regulations for our company. Take a moment to think about federal health insurance legislation from several years ago at the federal level. I think we can all agree that we do not want to hurry up and push any bills through in this great state without fully understanding the future consequences. As I mentioned before, on paper, this certainly seems like a step in the right direction, but without a true implementation plan to include costs to implement and manage, this is a bad bill for Arkansas and bad for Arkansas businesses. And I guess my question is, as Arkansans, are we truly
Sir,
open for business?
I would let you know that you're halfway of the time, it's 5 minutes.
Thank you, sir.
I
I'll yield my
You
time.
do whatever you want to do, but let you know. Okay, would you take questions?
Certainly.
Representative Love, do you have a question?
I just wanted to know the fiscal impact too. You're from Edwards Food Giant, so you're one of, number one, you're one of my constituents because Edwards Food Giant is in my district. But what is the fiscal impact to your company's bottom line?
It would be tremendous. I don't have a number for you. I just know it would probably, in our scenario, require an upgrade of register system, which average store, that's $100,000. So you're looking at, for us, a little over $1 million, depending on the specifics of the plan and how it came back. So it would be a tremendous burden. And then I guess the biggest cost would be an ongoing cost of employees and the maintenance. And the real thing is, we want to do what's right as retailers. We want to be above the law. We want to do the things that are supposed to be done. And if we don't get the information from the state or the federal government in this case, I'm not sure where that would come from because it's not yet been determined. But if we don't get the information we need to follow the rules, it's hard to follow the rules.
Follow up, Mr. Chair.
You're recognized.